The next one is for Janelle. Are there any known care homes for people with HD that have people that actually specialize like HD care?
Yes, there are very few. Most of them are in the northeast, north midwest area of the country. They do have highly specialized HD care. There is one, I believe it's in Kentucky, that was actively recruiting patients recently. And then they had to stop, unfortunately, because of COVID. The last information that I got, they're only taking patients from in state at this time. They do have HD informed CNAs, they have HD informed therapists, and those wings are very highly specialized. But they are very few and very far between. When people are looking for a placement for their loved one, we can work together as a team to provide education and support during that transition time. You want to find a facility that's going to be willing to have those conversations, that's going to be willing to establish a working relationship with a social worker specialized in HD or a specialized nurse with HD. With that, you oftentimes are able to have that person close to you so they can see you and then be able to provide that education and support to them with help. That unfortunately is a burden that falls onto the family a lot of times, and as much support as you can get from HD specialists, please reach out and ask for that, because that's what we're here for. I find that when I do in-services with nursing homes that I really get a lot of positive feedback, a lot of positive understanding with the providers. And I'm actually doing an in-service coming up with a facility that one of my patients has been at for probably about 4 years now, but they have new staff that's come in. And they're struggling with some of the changes that they're having to make on a constant basis to contain COVID. And so they're really wanting to try to make our patient very comfortable, but that is difficult with having to make rapid changes with the environment to stay on top of COVID. We're going to strategize some ideas, and this particular patient is a very good self-advocate. So he is able to say what distresses him a lot more than a lot of my other patients are. So having that relationship and collaborating with the Center of Excellence or a social worker specializing in HD can really help coordinate that care and education.
I know that a lot of people don't have an amazing Janelle or Lisa or these amazing social workers that are willing to do in-services that live in these more rural areas. We've been hearing about this so much. So like a sneak peek, and I'm probably not supposed to say anything, but I'm going to. We're introducing a care home publication with all of Katrina's extensive knowledge working in care homes for 15 years before she came to Help for HD. And we're going to have some publications that will help support you. Nothing's going to be as good as an in-service, but at least there'll be some support out there for you. And that's coming very soon. So watch out for that for sure.
Some of the centers of excellence, remember there only used to be 21 and there's now over 50 spread out much more geographically than they've ever been in any time of our Huntington's advocacy. But one of the criteria for those centers of excellences for levels 1 and 2 is that they have long-term care outreach. And so there's an expectation for these centers to do precisely this, to help educate nursing home staff. And Janelle indicates there's always opportunities to go back to the same places because of staff turnover. Some of the places actually visit nursing homes. There's a big nursing home, Huntington's nursing home outside of Minneapolis, and that's probably one of the biggest ones. The other one's circling around Boston, and then the Kentucky one is new to me, and there's also one in San Diego County. But the unfortunate problem with these is that they're generally state or county specific in terms of who gets in first. However, the majority of nursing home patients that I used to go visit were never in those specialized care centers. And some of those care centers became very good at, through those connections and those relationships. The other thing is some of the chapters. So if you don't have a center of excellence near where your loved one lives, Some of the Huntington's chapters, social workers, will go out. Sometimes just advocates will go out. Jimmy Pollard, who used to be an administrator in a Huntington's unit up in Massachusetts, has several publications about how to talk to nurses' aides. And you can download those, you can take paper, you can make some copies, take them to the facility where your loved one is. It's very easy, simplistic language dealing with that day-to-day management, how to deal with somebody who has perseveration, how to deal with somebody who is not as expressive, how to help people. One of his publications is called Hurry Up and Wait, for people with HD who need to have things right immediately. So there's a lot of resources, and if you don't have the professional connection through the centers or social workers or whatever, there's a lot of advocacy you can do yourself. And so that being said, what I also really want to stress, because I used to have a nursing home practice before I jumped into the Huntington's world. I've spent a lot of time in long-term care facilities. In my mind, the single most important thing for your loved one is actually you. The more people are visited by their family, the more visibility they get. Remember, any loved one in a nursing facility is in competition with 90, 120, 240 other people for the time and attention of caregivers in those facilities. And those guys work hard. They work really hard. And it's an impossible expectation to think they can meet 100% of the needs of 100% of people 100% of the time.